The Nigerian Institute of Medical Research says 32 cases and 22 deaths of cervical cancer are reported daily. The cervical cancer is a cancer of the lowest part of a woman's uterus, also known as the cervix. Today, this is our focus on sound health. Good evening, I am Olasumbo Modupe. The program continues in a moment. Please stay tuned. It is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Azeezat Ajose, a medical doctor and cancer advocate. She is also a research associate with NSIA Lagos University Teaching Hospital Cancer Center, Idi-araba, here in Lagos. Good evening, Dr. Ajose, and thanks for joining us.
Good evening. Thank you very much for having me.
All right, Dr. Ajose. According to the recent report by the NIMR, 32 cases and 22 deaths of cervical cancer are reported daily. What exactly is cervical cancer, and is it an age-specific disease?
So, cervical cancer is a cancer that affects the cervix. The cervix is the part of the female genital tract that connects the womb to the vagina. So after the womb, you have the cervix before the vagina. And when that part of the body gets cancerous, the person comes down with cervical cancer. Now, it is not age-specific. However, usually affects people within their reproductive age group, most commonly among women that are 35 to 44. But it can affect women that are younger than that, and it can also affect women that are older than that.
Dr. Ajose, what causes cervical cancer?
So, cervical cancer has been shown to be associated with a particular viral infection called the HPV virus. That's human papilloma virus. Now, it is not certain that HPV causes cervical cancer, but it is certain that it is associated with it. Because in about 99.7% of cases of cervical cancer, they actually have human papilloma virus infection, persistent infection with that virus. Now, this virus is such that it has certain proteins that goes to the cervix to target the tumor suppressor genes. That's what we call them. So these are genes that would not allow you to naturally have cancer. Cancer means that that part of the body is growing or proliferating at a rate that is more than it's supposed to be growing. Normally, you're supposed to have these cells grow, then die off, grow, then die off. But when they just keep on growing, you can have a tumor. So that is what this viral infection does to that cervix. It suppresses the work of those tumor suppressor genes, or it suppresses the work of those tumor suppressor genes and allows the person to be prone to developing a tumor in that area. Now, aside this HPV infection, there are certain risk factors that can actually modulate the potential for the person to have the virus. Now, what are these risk factors? The most important one is early age and sexual debut, or one of the most important ones, early age and sexual debut. So people starting to have sex before the age of 18 at a very early age. Other things include things like multiple sexual partners. So the way HPV is transmitted is usually via genital skin-to-skin contact, or genital contact, or even mucosal contact. Not necessarily full-on penetrative sexual intercourse, because that's very important. Unlike other sexually transmitted infections that most times will require that there is penetrative sexual intercourse, HPV can actually be transmitted by skin-to-skin contact. So for young adults that do not penetrate, but they're just having skin-to-skin contact, they're actually at risk of getting this virus. So things like multiple sexual partners, or even being with someone that has multiple sexual partners, is one thing to not have multiple sexual partners, but be having intercourse with someone that does, and the person is at risk. Other things include things like smoking. Women who smoke are more at higher risk of getting cervical cancer. Women who take oral contraceptive pills for a very long period, for up to 5 years, they are at higher risk. Women who have other STIs like chlamydia, gonorrhea, human immunodeficiency virus, that's HIV infection. women who get pregnant very early in life. So young girls getting pregnant before 18, at 16, they're at higher risk of getting cervical cancer. Women who have multiple children as well. So a woman that has more than 5 children is at higher risk than a woman that has just 2, 3 children.
Are there types of cervical cancer, Dr. Ajose?
Yes, there are. So most cervical cancers would usually start. So the way the cervix is the cervix is, it has an outer part and an inner part. The inner part is called the endocervix. It's a cervical canal. Then the outer part is the one that connects to the vagina that leads outside to the outside of the body. So the outer part of this cervix is lined by flat cells. We call those cells squamous cells, and they are the ones that are usually affected in most patients with cervical cancer. That type of cervical cancer, when it is those outer cells that gets affected, is called squamous cell carcinoma, and it is the most common type. However, if it is the cells that are inside that canal, usually they are columnar cells, they are like column-like cells, and they are glandular. If they're the ones that get affected, it is called adenocarcinoma. There are a number of other types of cervical cancer. However, these two are usually the most common, and they make up 90 to 99% of the cases of cervical cancers in women.
Dr. Ajose, it is a gender-specific disease. What are the early signs or warnings a woman should watch out for?
Okay, so again, linking back to the cause of cervical cancer, it is persistent HPV infection. So persistent infection with that virus that causes the cancer. Now, this virus you don't get the virus today and develop the cancer tomorrow. It typically would take about 10 to 20 years before a person gets the infection after being infected with the virus. As such, within that 10 to 20 years, the person may not have any symptom. In that early stage of the disease progression, the person doesn't have any symptom. When it gets to the point that the person has developed a tumor, that's when the person can now have symptoms like bleeding, so abnormal vaginal bleeding. So a woman that is bleeding in between her menstrual period, she knows that she sees her period for 4 days and is not supposed to come back until after, say, 28 days or 30 days. But then this month, all of a sudden, in the middle of the month, she's bleeding again. That is a worrisome sign and should be checked out. Bleeding after sexual intercourse, during sexual intercourse, is a worrisome sign. Bleeding in menopausal women. So once a woman attains menopause, she no longer expects to bleed monthly. But when a woman like that starts to experience bleeding, then it is a worrisome sign. Not to say that everybody or every person that is bleeding abnormally has cervical cancer, but these are signs that should necessarily warrant a person going to the hospital to get checked out. Other signs that people may have include pain. So a person is having sexual intercourse and they have recurrent pelvic pain or pain in the lower, pain in that area when you're having sex, or pelvic pain, it's worrisome. Then other signs of cancer, people lose weight when they have cancer. People have night sweats. They feel like they're always tired. Almost all the time they're tired, or they no longer feel they have appetite the way they used to. Those are also signs that require you going to the hospital to get checked out.
Apart from the early signs you mentioned, Dr. Ajose, how is cervical cancer diagnosed?
Okay, so diagnosing cervical cancer is usually the work of a medical doctor and an oncologist. A lot of the time, when a patient comes with these symptoms, we would usually send them for screening if they do not have a noticeable tumor. So this screening is done there are several ways to screen. The most common one is the cytology-based screening called the pap smear. This test is actually encouraged for every woman that is sexually active to start doing it from the age of 21. For women that do have a tumor and present to the hospital, there are certain procedures that we do. There's a procedure called colposcopy. During this procedure, you actually check the cervix to look at the type of tumor it is and take out some cells from it. Those cells are usually taken to the laboratory to do a procedure called biopsy. During biopsy, the pathologist would look at the cells and determine if it has gotten cancerous, or if it has gotten cancerous, and what type of cancer it is, based on what we said earlier.
As a woman, what are the risk factors you must know about cervical cancer?
Yes, so a number of people who have family history of cervical cancer and they are still coming down with it. For a number of cancers, there are genetic links to it. So a woman that has family history of cervical cancer should also be on the watch out. However, aside that, a lot of the time, the most important risk factor is persistent HPV infection. And that is the most important thing to know about. Knowing that anybody can be affected with HPV. You don't necessarily need to have had penetrative sex before you get HPV. A lot of people actually get HPV within the early years of their life when they have skin-to-skin contact or oral sex, vaginal sex, anal sex, or even hands-to-genital sex, because it only just requires you rubbing the skin of the genitals of someone that has it to also get that infection. And that's the most important risk factor for it.
Can cervical cancer be treated, Dr. Ajose?
Oh, yes, it is very treatable. So treatment and prevention would actually come hand in hand, because unlike every other cancer, cervical cancer is a vaccine preventable disease. So you can actually get vaccinated to prevent it. And when you do have the cancer, there are different stages of the cancer. So for some people, like I said, HPV infection will take almost 20 years before it develops into cancer. For a whole lot of people, because almost every woman that has had sex or would ever have sex would actually be at risk of getting that infection. However, for several people, once they get HPV infection, within a couple of months to years, the HPV actually clears out. It becomes a problem when it doesn't clear and it remains persistent in the person's system. Within 10 to 15 years, the person can start to have precancerous lesions. These precancerous lesions have not gotten to cancer, but it can as well progress to cancer. And there's a special way to treat that to make sure that the person doesn't ever get cancer, which would only be, and it can only be detected if the woman goes to screen for it. For cervical cancer patients, depending on the stage, the different stages of cancer, if the woman comes in at an early stage where it is still possible to just use surgery, so surgery would usually take out the entire tumor. That would be, so a management plan would be surgery. Then there can be use of medications like drugs that targets cancer cells. We call that chemotherapy, or the use of radiation therapy to kill the cells. So women can either get surgery, chemotherapy, or radiation to treat this cancer. And yes, it is very, very treatable. The survival rates in high-income countries are very high. For a lot of them, it is actually even said that in developed countries, they have a 280% higher survival rate or higher chances of surviving this disease than we in developing countries. And the main reason is because people get to diagnose themselves with it at a stage where other organs are already affected because of spread. However, if you do screen early and you diagnose it early, it is very treatable and a lot of people can survive it.
What can I do to reduce my risk, and is it preventable?
Yes, it definitely is preventable. So there are different ways that you can prevent the disease. I would start with preventing the HPV infection itself. So like we said, 99.7% of cases are linked to HPV. So what are the ways to prevent HPV infection? People not having early sexual debut. A girl or an adolescent should ideally not have sex until at least the age of 18. Having sex earlier than that increases the risk significantly. Having multiple sexual partners, having sex with people that have multiple sexual partners, these are things that can predispose you. So when you avoid all of that, you avoid you reduce your risk of getting HPV infection. Then you can also reduce the other risk factors that can modulate this HPV infection and allow it get to cancer. Things like smoking. So people not smoking can reduce that risk. Not having more than 5 children at a time can reduce the risk. Not getting pregnant at an early age can reduce the risk of a woman getting cancer. And then to reduce the risk of you getting HPV itself as well, you can also get vaccinated. So there is HPV vaccine that is available in Nigeria. I know for certain that it is available in Lagos. It's available at the Lagos University Teaching Hospital as well. There are 2 different types. There's Cervarix and there's Gardasil. And usually it is encouraged that young girls that before they start having sex, that is the ideal time that everyone should get this vaccine. Before you start having sex at all, before you get exposed to it. From the age of 9, girls are encouraged to start getting vaccinated. So parents that have children that are aged 9, 10, 11, even boys, because the same HPV vaccine has actually been linked to penile cancer, anal cancer. So even boys are encouraged to take it. But for the purpose of cervical cancer, women from the age of 9 to 26 can walk up to any center where they take this vaccine to get vaccinated, because it significantly reduces your risk of getting the disease at all. Then other ways that you can prevent it is screening. Like I mentioned, it takes a long time before it gets to cancer. So if a woman gets screened regularly, you can detect it if there are already precancerous lesions and treat that before it progresses into cancer. The screening methods, you have pap smear, like I said before. Pap smear should be done ideally every 3 years for women that are within 30 and 65. You should do pap smear every 3 months. Another way of screening is to actually do the HPV DNA testing, where they actually check if you have that HPV at all. That one is usually done every 5 years, or you can do both as well every 5 years, at least up to the age of 65. For women that are 65 and you've seen that they've done this testing severally, they don't have HPV, pap smear has always been normal up to this point, they can't stop. For women that have other risk factors like HIV, even though they're 65, they should still continue.
Is the HPV vaccine available and affordable? And can a woman over 40 years or sexually active woman get vaccinated?
Yes, the vaccines are actually available. And I think that the federal government is already making steps to include it into our national vaccination program. However, for affordability, I remember that it used to cost about 15,000 naira per dose. It usually is around that range. And a woman needs 3 doses to be fully vaccinated.
Three
For
doses.
young girls, yes, which is about 45,000 naira.
Okay.
But then you know that you've significantly reduced the risk of getting this cancer because the cost of treating cervical cancer runs into millions. But the cost of getting vaccinated is just about 45,000 naira in most places. And hopefully, once we introduce it into our vaccination program, that cost will get significantly subsidized. For women that are over the age of 26, yes, they can still get vaccinated. However, it is no longer as efficient as it would have been if they got it much earlier. So again, it is encouraged for young girls, adolescents, young ladies that are within 11 to 25 or 26 to get this vaccine. However, it is definitely also allowed or encouraged for women that are also over the age of 26, 40 to still get the vaccine.
The deadline for the 2030 agenda set by the World Health Organization is fast approaching. How do we scale up as a country?
Okay, so one of the ways that we can do that is what we're already doing, raising awareness about cervical cancer. When people know that this cancer, unlike every other cancer, when they say what causes it, they say, we don't know, we're still thinking is this and this. This particular cancer, we already have a strong idea what can cause it. We already have strong ideas what you can do to prevent it. So when people know that they can take up preventive measures, get vaccinated, then it will be easy for us to meet that target by 2030. When people start to get screening, also, when people get screened and they get themselves treated early, we also know that we can easily meet that target. Then, like I said, vaccination. In this part of the world, minimum wage is still, I think, 33,000 naira. So a number of people cannot actually afford the price that it takes to get that vaccine. So for governmental bodies, non-governmental bodies that can provide access to these vaccines for people that cannot afford them at subsidized rates or even free. If we can get more people doing that and raise more awareness about it and people get screened in order to detect it early, then I think that definitely we would be able to meet that target.
All right, be informed, be screened, and get vaccinated. Dr. Azeezat Ajose, medical doctor and cancer advocate. Thank you so much for your time on the program.
Thank you very much for having me.
I have been speaking with Dr. Azeezat Ajose, medical doctor and cancer advocate. She is also a research associate with NSIA, Lagos University Teaching Hospital Cancer Center, Idi-araba in Lagos. Up next is Trending Health Report from around the world. Please stay tuned. Now, this is where we say thank you on today's episode of Sound Health. Cervical cancer is treatable if detected early and managed effectively. Get screened, use condoms, and get vaccinated. For comments and inquiries, or you have topics you would like us to treat on the show, send SMS to 0035826603 or follow us on social media at LTV Social #SoundHealth. A sound health is a sound mind. Make healthy living your choice.